On our agenda today, in just a few moments, I'm going to kick it over to Shani Parkin from Moffitt's Patient and Family Advisory Council to do a welcome. We'll hear from Jack Kolowski, Jane Fusilero, and Dr. John Green on Moffitt's response to COVID-19, the safety measures that we've put in place, and we'll also get to hear a little bit of kind of what's the latest science, what's the latest thinking around COVID-19. We'll hear from Dr. Keenan on just some tips and advice that we want to make sure our patients are aware of. And then last but certainly not least, we're going to wrap up our presentation today with a perspective from both one of our patients and from one of our caregivers here at Moffitt. So then for the remainder of our time, we'll make sure to address any questions that you have. So with that, I'm going to hand it over to Shani.
Thank you, Katie. Well, good afternoon and a huge welcome to all of our patients and family members who are participating in today's COVID-19 patient and family webinar. My name is Shani Parkin and I am the co-chair of the Moffitt Cancer Center Patient and Family Advisory Council. You may also hear that referred to as PFAC. In January 2014, I was diagnosed with malignant melanoma. And while I was reviewing the biopsy with my dermatologist, he recommended and referred me to Moffitt Cancer Center's cutaneous department. From the very first appointment with the surgeon and the interactions with his clinical team, I knew that I was being treated by the best. And thanks to them, I recently celebrated being 6 years cancer-free. The COVID-19 pandemic has been difficult for everyone, and even more so for those of us who are cancer survivors, patients currently in treatment, and those who are caring for someone with cancer. Unfortunately, the virus will be here for the foreseeable future. But as we all know, cancer doesn't stop for a pandemic. The purpose of today's webinar is intended to provide you with current and accurate information regarding our COVID-19 protocols here at Moffitt Cancer Center, helping to keep you safe, the latest science, and we'll also hear, as Katie said, from a current patient and a caregiver who will share their challenges and their experiences with COVID-19 appointment experiences with us here at Moffitt. And of course, we want to hear from you and the questions that you might have. The Patient and Family Advisory Council, or PFAC, was started in 2005 and is comprised of a diverse team of volunteer patient and family advisors who themselves have either been a patient or a family member of a patient who has received treatment. For the past 15 years, council members like myself serve as the voice for the patients and their family members, and we are fortunate to have the opportunity to work alongside the senior leadership and executive team, physicians, nurses, other healthcare providers and administrators to provide them with constructive feedback and specific situational information. For example, patients and caregivers' needs and concerns. We work with staff to make changes that impact patients and their families. We participate in the design of patient care areas and also assist in the planning of new patient-related programs. And finally, we serve as a resource on a wide variety of issues, services and policies. Additionally, we work alongside Moffitt's patient experience team to ensure that you have resources available to you. For example, the Partners newsletter, which you'll hear more about later on in the webinar. I'm often asked by family, friends and colleagues why I'm so passionate about Moffitt Cancer Center and my role as a volunteer patient advisor. Firstly, it provided me with a more meaningful way to say thank you to every single Moffitt team member. And no matter their role in my care, they went out of their way to make a difference for me. Secondly, serving on PFAC provides me with a platform to share not only my own experiences, but also the experiences of the patients and families who I meet during their visits. Every conversation that I have with a patient provides me with the opportunity to make a difference in their day, especially when they are newly diagnosed and a new patient. It gives me the opportunity to show them around the location and introduce them to the patient library team. But most importantly, being a good listener, embracing their concerns and fears, and letting them know that from my own personal experience, that by choosing Moffitt, they've already made a great decision. Thank you so much for joining us today. And now I'd like to introduce Moffitt's Chief Operating Officer, Jack Kalowski, who's going to share how Moffitt has responded to the COVID-19 pandemic. Thank you, Jack.
Thanks, Janie. And hopefully everyone can hear me.
Yes.
Okay, good. So my name is Jack Kalowski. I'm, as Shani introduced me, and we wanted to have this update really to give you an idea of both how Moffitt is responding and what some of the facts are around COVID. So let me share some of those pieces of information with you. As of today, since the beginning of the pandemic, we have had 65 patients who have been diagnosed with COVID. Many of them were identified through our pre-admission testing or pre-procedural testing that will be described to you in a little bit later on. They may have been asymptomatic at that time. And, but nonetheless, we wanted to get those tests done so that we would understand what, if anything, we were facing in terms of COVID. I will compliment all of the patients here because cancer patients are the most cautious, careful people that we know in terms of socially distancing, wearing masks, things like that we all know are important in fighting this disease. On the other hand, things happen, and the disease can be transmitted through a variety of different methodologies. As far as we can tell, all but one of those patients contracted that in the community. The one who did contract it at Moffitt happened to be from a visitor who was also asymptomatic, but nonetheless transmitted that disease to them while they were an inpatient in the hospital. We've also had 161 team members who have been diagnosed, and all but a handful of those also were transmitted, acquired that disease in the community. And again, how do we know? We know that either when their work schedule was and what the incubation time would be for the test to turn out positive. We've also known when there are certain things that are happening when they weren't at work, things along those lines. And those that acquired the disease inside the hospital acquired it from typically asymptomatic patients. So in that case, we are grateful for that number. They're relatively low numbers, but we're also monitoring this very closely. You're going to hear in a few minutes from several of our leaders in terms of the steps that we are doing to make it safe for all patients as they come into Moffitt. And so with that, I am going to turn it over to, I believe, Jane Fusiliero, who is going to talk a little bit about the testing.
It is me.
Jane?
Thank you, Jack. As Jack has mentioned, we really do want to assure you that your health and safety is our top priority. And to help achieve that, one of the things that we have done, and I'll talk about it in further detail in a bit, is providing screening and other safety measures at the hospital entrances. And in addition, Jack mentioned that we do COVID-19 testing for all our patients that are going to surgery and or going through a procedure. And very recently, within the last couple of weeks, we've also provided testing on admission for all of our inpatients as well. So those are just a couple of ways that we want to assure you that your health and safety is our top concern. Next slide, please, Katie. So when you come into the hospital or to the clinic, these are a couple of things that you should expect at your visit. We do provide health screening at each of the entrances. So that would be, if you're coming to the Magnolia campus, that would be at the Gold Ballet entrance for the clinic, at the Red Ballet for the hospital entrance, and then also at Blue Ballet, which is primarily designated for radiation. And at that time, you will be provided a mask if you're not wearing one already. There will be certain questions that are asked of you by the healthcare screeners. And some of those questions have changed because of recent changes from the Center for Disease Control. But one of the new ones is to certainly ask if you've been asked to self-quarantine because of a known exposure. So that's a new one that's been added, as well as we are now asking you to hand sanitize on your way in. Once you've gone through the screening, then you will be escorted if you have mobility issues, or you will be asked to move on to your clinic, if you will, so that you can be there for your appointment. If you are going for radiation, the same thing. You will be asked to walk over to the clinic, and or you will be escorted by a transporter if you have mobility issues. We ask that when you are in the waiting room that you follow the markers that we have on the seats for social distancing. If you do need to enter an elevator, we are trying to ensure that the elevators are limited in terms of their capacity to around 4 to 6 people. That sometimes is a little bit more challenging. And then because of the fact that at this point for the ambulatory areas, we do not allow visitors or family member to accompany the patient, we ask that you either use your iPhone, or the nurse or medical assistant can provide an iPad so that the communication between the provider, yourself, and your family member can be assured. So those are a few things to expect at your clinic visit. Next slide. Visitor policy. So we have had a visitor restriction policy in effect off and on throughout the pandemic. One of the things that is hot off the press that I get to share with you today is that we will be lightening up our visiting policy for the inpatient areas. And beginning tomorrow, we are going to be allowing families to visit their loved ones on the inpatient side, just one family member to visit for a time of about 2 hours, and we will have visitation open from 11 to 6 p.m. So that's brand new. I know Katie is working on a flyer to hand out. We are also then going to do the same for patients undergoing procedures and or surgery, and we will allow one family member to accompany their loved one for surgery. They will be able to wait in the waiting room during the surgical procedure and then accompany the patient back up to their room for the 2-hour stay, regardless of the time frame. The ambulatory areas, I will tell you, are not going to, we are going to maintain the no visitation policy for the ambulatory areas, although we do have some select cases where we do make exceptions, and wanted you all to certainly be aware of that. So I think that is all I have to say in terms of actually the visiting policy that will be changed as of tomorrow for the inpatient areas. One thing I would like to just remind you all of is that when you as a visitor might be accompanying your patient to or coming in to visit your family member that is an inpatient, that you will go through a screening and then you will be sent to the concierge desk for a label that you could put on, a tag that says you've been screened and that you are allowed to visit the family member. So we wanted you to be aware of that as well. And I think with that, I'm going to turn it over to Dr. Green, who will provide us with information on the latest science. I know Dr. Green requires no introduction, but he is the Section Chief of Infectious Disease. Dr. Green?
Yes, thank you. It's good to join you all in this forum, and I'd like to answer some frequently asked questions on COVID-19. Next slide, please. So the first question we have to ask is, how many cases of COVID-19 are in my community? Back in March, we had 1 in 1,000 people in Hillsborough County positive, whereas in Miami-Dade, they had 8 people out of 100 positive. So different counties have different levels. We had an increase in April, and then it went down in May and June. And then we had our second peak of infections in July. And as you know, it's heading down in August. The school was holding off on opening until they can be less than 5% cases positive per total test done, which has been achieved for the most part in Pinellas, is on the border with Hillsborough, and it has to be sustained for 2 weeks. So our number of patients with COVID-19 on our screening is extremely low and has been low. It's 10 times lower than our bigger hospitals like Tampa General, and that's because cancer patients are very careful, and so are their families from getting infection. So we track all of these things, including new cases, people in the hospital, those that visit emergency room with flu and COVID-like illnesses, and it's definitely going down, and we hope it will continue going down. The unknown is whether it will go back up when schools reopen and when the flu epidemic starts to come up, or the flu season opens in October, November, December. Next slide. So another question is, how well has Moffitt developed COVID testing? Initially, we had no ability to test, and within less than a month, our lab has done an incredible job getting testing up. Next slide. And they have done over 10,000 tests, and they run them Monday through Friday at high levels, and now are testing on Sunday. And we ramped up testing to include everything from prior to chemo, prior to transplant, prior to radiation, prior to various other treatments, and all admissions. And then the sickest and most immune-suppressed patients in the bone marrow unit are tested weekly. We do not test healthcare workers because we don't think that's helpful or useful, but we do screen healthcare workers at the door. To test people, like, for example, to go back to college, they recommend you get tested every 2 days, which is not feasible for most colleges and hospitals. And so testing healthcare workers is not a good idea. You can see most of our tests are prior to chemo, and the rate of people that are positive of all the people with no symptoms ranges from 1 in 200 to 1 in 500 people have no symptoms test positive, and then we take care of them accordingly, and we try to keep people that are positive away from treatment and the hospital until they are clear of infection. Next slide. How am I most likely to get infected with COVID-19? Next slide. So the number one way that you would get infected is a family member, and usually it's a family member with no symptoms. If you happen to work in an environment, at least early on, where wasn't very well done social distancing, the coworker and at work was number 2. Friends, healthcare personnel was a concern in March and April, but now with all the parameters in place, the safest place you could be is in the hospital, because the strict testing and requirements of mass social distancing, cleanliness, etc., hand washing is to the extreme. So healthcare exposure is minimal. And that means, can you go to your dentist, eye doctor, and other places? And the answer is yes. Just make sure they're following all the usual rules, which I'm sure they are. And even my 98-year-old mother went to the dentist, who's very immune suppressed. So I would definitely recommend that you don't postpone well care very much longer, which I'll show you why in a minute. Next slide. So it's mostly spread by being less than 6 feet from someone with a droplet without wearing a mask and inhaling that. You have to be less than 6 feet for more than 15 minutes. So a casual walk by somebody is not going to be a big issue. Traveling on airplanes that are packed, wearing your mask will prevent an infection, but of course social distancing is very important. There are possibilities of it spreading farther than 6 feet, but that's extremely rare, called airborne. And catching it by your hands and touching things or shaking hands is extremely rare, but it's a good idea to wash hands and to clean high-touch areas. Next slide. How long is a COVID-19 infected person contagious? Next slide. So the CDC has clearly come out with guidelines that say after 10 days, people are not excreting live virus, and even though they're testing positive by that nasal swab for sometimes weeks and months, those are dead pieces of virus and they are not contagious. So 10 days is the limit of how long someone is contagious who tests positive. However, if you're immune suppressed, which is many cancer patients, it could extend up to 20 days, and beyond 20 days, just about nobody is contagious beyond 20 days. Next slide. How do some people infected with COVID have no symptoms and others get very sick? Next slide. So you can see from this slide at the top, the virus during stage 1 replicates and grows. And this is when people are contagious and they start getting cold-like illnesses and cough and congestion and fever. And some people develop no symptoms whatsoever while the virus is replicating, but they could be contagious. During stage 2, the immune system kicks in and you may actually feel sicker because of the immune system kicking in. And some people get sick enough they get admitted to the hospital because of that lung problem, the pulmonary phase where you're having problems breathing. The worst case scenario is stage 3, which happens in a few people, and they are getting very sick and may wind up in the intensive care unit, and their immune response is actually what's causing damage to their lungs and other organs. So all the drugs you see at the bottom, we at Moffitt have been able to get and use effectively, including remdesivir, steroids like Decadron, and a bunch of other drugs like tosumumab. And we do convalescent plasma with all good success. So we have treatment available for all those phases. Next slide. So age is very important. And if you're 80 or higher, your risk of not surviving COVID is almost at 15%. Whereas if you're 0 to 9, your risk is incredibly low, 1 in 1,000 to 10,000 chance of having a bad outcome, and all the numbers in between. If you have cardiovascular heart problems, you have a higher risk, diabetes, respiratory disease, not asthma, but emphysema and COPD, hypertension, cancer is a risk factor, and obesity increases your risk for bad outcome up to 3 times more than if you're not overweight. Next slide. So how can I protect myself from catching COVID-19? This is an important question. So the number one thing you could do is wear a mask. So that's definitely going to give you the best, even if you're on a crowded airplane, a mask is the number one protection. Number 2 is social distancing, keeping 6 feet. If you do those 2 things, you have a 99+% chance of protection against infection. The next important, in my opinion, is hand washing. So that is still important. We recommend it frequently. And then the 4th most important is cleaning and disinfecting. By doing all these things, your risk is bare minimum of catching the infection. Next slide. So what mask is best? Well, in the hospital, we can be test fitted for those N95 masks, which is number 14, but they are in short supply and most patients can't get a hold of them. And when they can, they don't know how to properly fit them. So any surgical mask or cloth mask will be effective. Whether those neck collar ones or a bandana helps, we feel it's better than nothing, even though some people claimed it might be not as effective. Anything you cover your mouth with 2 layers or more is a good idea. Next slide. And these are showing you the best, lowest chance of getting infected wearing a mask is an N95, which we use in the hospital, test fitted and surgical mask. Everything else, including your cotton mask, etc., they're very good and effective. The bandana and the fleece are less likely to protect you. Next slide. How has COVID-19 affected cancer patients during the pandemic? Next slide. So you can see that even though breast cancer, colon cancer, lung cancer, stomach, pancreas has not decreased because of COVID-19, the number of diagnoses have decreased because people aren't coming in. They're afraid to come get their care, which is a bad thing because then it could be caught at a later stage. So we're encouraging people, the hospital is safe. You should be getting your care and consider screening for cancers because this is causing some problems with people not being diagnosed soon enough. Next slide. Last but not least is probably every one of you have experienced your appointment being missed, postponed, or canceled. That is now no longer happening, hopefully. Telemedicine is still happening, but not like it was before. And we like to see people in person a lot of times, but if we do telemedicine, that's still okay. And then there's all the other things that are concerning, including I'm too nervous to go to the doctor's office or have surgery. And we're trying to encourage you to not delay that further. Next slide. And now Dr. Keenan is going to talk to you about things you need to know about cancer and your treatment and diagnosis and how to handle that. Thank you for your attention.
Thanks, John. So I just to pick up where Dr. Green left off, back in the spring when this pandemic first arrived and was working its way through the country, Moffitt quickly assembled a fairly substantial group of individuals to work on a number of different protocols that we would use to respond to the pandemic. And we also developed triggers that we would use to make decisions about when we needed to alter our operations. And that went all the way across through the Cancer Center, including the research operations as well as administrative operations. And we looked at kind of 4 levels, from level 1, essentially normal operations, to level 4 being a disaster. But fortunately, we never really in any one area got much beyond level 2. Where we did have to cut back, as I'm sure you recall at the time, is there were requirements that were imposed, for instance, by the governor's executive order, that elective surgical procedures needed to be postponed. And obviously in a cancer center, there's very little that's elective, but screening is elective. And there certainly were some surgical procedures that were elective. And so we needed to postpone those. But once we kind of got over that first peak, we fairly rapidly started to bring back online the screening testing that we want to do, particularly screening mammography, colonoscopy, and the like, as well as work through that backlog of surgical procedures. And so we are and have continued through this second peak to maintain normal operations. And I've talked with our radiology people and our diagnostic screening mammography operations are fully open and ready to go. And so, as Dr. Green has suggested and others have, cancer does not wait for COVID. And we already are seeing some evidence he showed you a graphic, but there's other evidence that suggests that potentially as many as 10,000 excess deaths might occur in this country over the next decade related to breast or colon cancer that was not picked up as early as it might have been. So we really do want to stress the importance of getting those screening type procedures where they are available for the kind of cancer that you have. Now, fortunately, again, as people have said, we seem to be on the downswing of this second peak, and we actually haven't had any inpatients admitted with COVID in the last 10 days, and that's a good thing. And I think large part that's a tribute to cancer patients, and as everyone has said, how carefully you take care of your own health. So that's very, very important. The other thing that I want you to know is that coronavirus is something that we know how to deal with. It's a family of viral illnesses that we know what we need to do in terms of personal protective equipment and the precautions that we need to take. It's a virus that we know we can kill with the disinfectants that we use, and we do use them across the facility. And so we really do everything we can to try to make Moffitt as safe a place for you to come for your visits or for your treatments or for screenings as we can possibly make it. Dr. Green mentioned testing, and testing is very important because when patients need treatment, whether it's surgery or chemotherapy or radiation, there can be certain risks to undergoing those treatments if you have COVID. We know that to be true in the surgical population, where patients who were asymptomatic with COVID had surgery and then developed complications afterwards. That hasn't been our experience, but it has been experience reported elsewhere in the world. Similarly with chemotherapies and certain types of chemotherapies that really suppress the immune system. And also certain types of cancers like hematologic malignancies, for instance, where we know that the bone marrow suppression is such that developing an illness like COVID can have catastrophic consequences. Lung cancer is another one where just by the nature of the lung cancer itself and the way COVID affects the lungs and other systems can be particularly devastating. And so this is why, as we developed our testing capability, we started to expand our scope of testing asymptomatic patients before they would undergo surgery or before they would undergo chemotherapies. And even radiation, which by itself isn't known to have a significant risk, we've been testing patients who are undergoing radiation for the chest and above, as much for the protection of our team members as it's been for the protection of our patients, because the radiation therapists need to spend so much time in close proximity to a patient's mouth. And even though you're wearing masks and that should minimize the risk, we felt it was important all around to test for those kinds of patients. The other thing that I think we want to make sure that you realize is that we have learned, and globally, the medical community has learned an awful lot since coronavirus first surfaced a number of months ago. We've learned a lot more about how to detect it. We've learned a lot more about how to treat it. And we're much better in our treatments than we were when these things started. And so, again, while we have had patients with COVID in our facility, the vast majority of them have recovered and gone home because of how we've been able to treat those patients. Dr. Green mentioned virtual visits. And certainly I'm a proponent. I'm a thoracic surgeon, and I'm a proponent of virtual visits. We went from doing almost none of them back in early March to where we were doing over 1,000 a week by end of April. And we've settled down to a nice number. And I think telemedicine visits will always be a part of what we do. But we aren't going to need to do them in quite the large numbers that we did before. And part of the reason is because in some cases there really is no substitute for an in-person visit, whether it is because of a physical exam or some other factor that really just can't be successfully done through a video link. So in person is the way we would prefer to do it if possible. If a video visit can provide the same value, that's perfectly fine. But one of the things that I would recommend you do is if you are going to do a virtual visit, a video visit, and you need to have some type of diagnostic imaging or blood work, I would still and strongly urge you to have those studies done at Moffitt. And the reason for doing that is because we want to make sure that the quality of the imaging, in particular, is as good as it can be. As I said before, we're doing everything possible to make our facility as safe as possible. So we want you to get your test in as safe an environment as possible. We want that test to be as high quality as it possibly can be, and we want the interpretation of that test to be as high quality as it possibly can be. So there may be an option to come in on a weekend or after hours and have the test done, and then conduct a video visit on another occasion, if you should choose. The other thing that I want you to keep in mind with regard to these virtual visits, or even just having a visit at all, is that it really depends on where you are in your cancer journey. If you're in a surveillance mode and you're just being seen once a year, for instance, then delaying a visit for a month or so isn't going to make much difference. But if you're in the middle of active treatment or early on after your treatment has finished, the difference between getting a visit tomorrow and getting a visit a month or two down the road could be substantial in terms of picking up something or an early identification. So we really want you to try to make sure that we keep those appointments as much as possible. So as I said, cancer doesn't wait for COVID, and we will do everything we possibly can to make this as safe an environment as we can make it. And one final thing I would say, and I'm going to say this with Jack on the line and others, is that we know that this has been a trying experience for patients in terms of employment and maybe loss of insurance. Well, we will work very hard with you to get through when you're in active treatment. We can't let your insurance situation alter that whenever possible. So we don't want that to be a limiting factor for how you are managing your cancer with us. And with that, I'm going to turn that over to Patty.
Thank you, Dr. Keenan. Hi, everybody. I'm Patty. I am a metastatic breast cancer patient here at Moffitt since 2002. Today, I want to share with you a little bit of my experience as a cancer patient living in a pandemic. But before I get into that, I do want to say to each and every one of you, if you were a cancer patient that was ending your treatment when COVID hit, or you were a cancer patient just starting your cancer treatment when COVID hit, or if you are an active cancer patient like myself in treatment, then you already know that COVID brought a whole new level of anxiety to all of our lives. For me, COVID-19 brought greater risk to what was already and is risky conditions. I started to find myself thinking about, do I need to cancel my treatment to stay home? Should I cancel my doctor's appointment? There was so much going on between news and friends and family talking about it. You started to question your care. You started to question whether, it was safer to delay things versus go out and about. In March, when COVID hit, I was just recovering from some side effects of medication that impacted my immune system significantly. In March, when COVID hit, I was just adding a new medication to my treatment plan that was going to require me to come over to Moffitt for once a month doctor visits, labs, and shots up in the infusion center. So in mid-April, when I drove over to Moffitt, I noticed as I was driving that I was a little bit more anxious than normal. I noticed that the grip on my steering wheel was way too tight. I noticed that my palms were really, really sweaty. I noticed that I was a little bit heavy with my breathing and sighs. I knew that Moffitt had made and implemented some changes, but not knowing 100% what I was going to be walking into kind of took my breath away the closer I got to Moffitt. When I arrived, I just parked, I grabbed that mask, and I headed in. I can tell you, once I went through those doors, I automatically just wanted to run a sprint and get through every floor and every appointment and just get back to my car, because there I felt safe. Finally, 3 hours later, back in my car, mask off, I sat there and I was proud. I was like, well, you got that one done. I didn't realize until that moment how nervous I actually was about heading into Moffitt for my appointments. So it took a couple minutes of sitting there and observing and watching people come and go. But I realized that Moffitt was still going to be my safe place. Moffitt was still the place I trusted with my care. And it was so obvious by all the changes that they had quickly implemented that not only was their compassion and their concern for my well-being still front and center like it had been before COVID, it was even heightened, I think, quickly during the first couple of months of COVID. So between all the changes that Moffitt made, and they were quick, and they changed daily, and all the coverage that the news was giving to COVID-19, my anxiety level was with me front and center constantly. And the knowledge, knowing, as Dr. Keenan said in one of his slides, knowing that I was immunocompromised and it put me in that high-risk category with COVID, I just had to walk away nearly from the news because I was really, truly considering not continuing my monthly visits. I really was truly considering just interrupting my treatment for the safety of my home. Because, see, at home, I could control my environment. I could control who came in it. I could control who came out of it. Outside, not so much. So then I turned to Moffitt for support, and I turned to Moffitt for virtual support. I attend Moffitt's metastatic breast cancer group once a month, and there I get to unleash all my anxiety and fears, and I get to share that with a bunch of people that have the same worries and fears as myself. I'm not really sure how long COVID's going to last, and I'm not really sure how long Moffitt is going to continue to have to keep in place some of the changes that they made. But I can say this, as a patient, I know I'm in the best place possible. And as my father always said to me, as when I was a kid, remember, Patricia, what goes up must come down. And I remember that every single time somebody wants to share COVID cases with me, whether it's in a text or whether it's a conversation, I just step back and tell myself what goes up must come down. And secondly, I want to share that my disease has taught me, and it's been a long journey with this disease, that when things get out of control or feel overwhelming or are just too much, I remember that it's okay to take it one day at a time, one moment at a time. And when I feel like my breath is being taken away from all the data and all the information and all the busy chatter that goes on in our daily lives, I just step back and say, and remind myself that I have everything I need right here, right now, in this moment. And I hope that if you feel that level of anxiety as you take on your journey with cancer, that you will remember you have everything you need right here, right now. Thank you so much. And I think I'm going to turn it over to Laura Barber. She is a caregiver and a patient.
Thank you, Patty. Good afternoon, everyone. I'm Laura Barber. I am a Moffitt patient, caregiver, and volunteer. My cancer journey was through breast cancer. I'm 17 years out from that now, but I'm still a Moffitt patient. I'm part of the survivorship program. So although my cancer is a little bit more in the rear window, I do come in for my annual wellness exams and to meet with my physicians and the team at Moffitt. My husband, Steve, is a much more current and active Moffitt patient, and I am his caregiver. He was diagnosed in 2011 with myelodysplastic syndrome, and he did have a peripheral stem cell transplant, more commonly known as a bone marrow transplant, at Moffitt, very successful from an unrelated donor. But he is an active patient because he still has his port, which needs to be flushed every 4 weeks. He still gets labs, and he still sees his physician on a frequent basis. So through my cancer journey and through his, Steve and I have been a team. I've been to every appointment with him. He's been to all of my appointments. We always go together where the first person the other one sees coming out of surgery, and COVID really messed up our whole routine. And everything that Patty said and shared with you, I completely agree with. The anxiety, the loss of control. Even when I take Steve to get his labs and port flushes and I'm driving up to the Gold Valet, it seems different. Because we're in a different time right now, but we will get through this. So if you're new to Moffitt and new in your cancer journey, I just want to tell you, you are in a very special place. And it's because Moffitt is so special is why I invest so many hours volunteering there. All of the campuses are pristine, and I know you're going to find that the team members are not only professional and helpful, but they are very compassionate. Moffitt is a place like no other, so please know you're in the best possible place. We all call it our safe place at the council. We hear that a lot, and I've heard the word safe used quite a bit today. Steve and I have now had 2 virtual visits from the comfort of our home. I was highly skeptical about this going into the first one. And I do want to share with you that I now see where virtual visits and telemedicine is probably going to be a part of healthcare going forward. And as the others have mentioned, it doesn't take the place of always a physical exam, but there are many times where it's a convenience, and other members of your caregiving team can participate, even if they're geographically far away or physically would not have been able to travel to Moffitt. 2 weeks from today, Steve will have his first physical visit with his team, and I will not be there physically, but I will be there virtually. So I'm either going to conference call in or Zoom, and so I'm going to be a part of it, and I feel comfortable. It's not the same, but I'm feeling comfortable and confident about this. So I want to let you know, if you've driven a long way to get to Moffitt and you suddenly get there and your phone, the battery's gone and you forgot your charger, or you say, oh, I meant to bring my iPad and I left it at home. As a caregiver, the patient relations group has really stepped up, paid attention to detail, and provided for this. So there is access, and you would have it, to chargers and iPads, so that you will be able to participate even if you cannot physically get into the clinic. We mentioned Partners Magazine before. That is a quarterly publication from the Patient and Family Advisory Program. And I especially encourage you to check out the current summer issue. It's you can download it at moffitt.org. And it is really focused on caregivers and patients, and all the resources Moffitt is offering during this time of anxiety. Cancer's enough to be anxious about, and then having COVID just adds all to it. So in closing, I would like to just touch on self-care. When Steve was in the middle of his journey and I was 24/7 and going like crazy, everyone on his team told me that I should take care of myself and practice self-care. I did not, and that was a mistake. So please learn from my mistake, and it's very important for both the patient and the caregiver. Sometimes you feel like all the attention's on the patient, but the caregiver is suffering a lot of turmoil as well. So self-care looks different for everyone. I just encourage you to find something. I encourage you to find something that involves physical movement, something that involves mindfulness, that could be the same thing, and something that just brings you joy. So I wish you all the best in your journey, and thank you so much. We really appreciate you joining us today.
All right. Thank you so much, Laura. So really quickly, I will share with you just a few of the different support groups that Patty mentioned. So really the Moffitt team, we've done our best to kind of get these things out virtually so that you do stay connected. All of our support groups are by licensed oncology social workers, and here's a listing of all of the times that they can meet and how do you contact them to schedule. The next slide is are actually things you heard about as well. The Partners magazine that Laura told you about, it's a quarterly subscription that comes out right now virtually. The COVID information hubs, that we have a lot of questions in the QA specifically about our restrictions. We ask that you visit the COVID information hub for the latest. As Jane mentioned, those are changing as of tomorrow for the inpatient visits. And then we have our Endeavor, which is our latest Moffitt and cancer news stories. You can stay on top of research and hear just the latest updates that are available to us here at Moffitt. Next slide, please. We do have a lot of questions, Katie, in the questions and answered. I know we only have about four more minutes. Did we want to read one or two, or?
Yeah, I think we've got time for just a few questions. And, of course, along the way, we've answered quite a few of them via just the text exchange there. I will say, though, too, of course, if you have a question that's specific to your circumstances, your care or treatment plan, we do highly encourage you to reach out to your care team and to your physician. They'll be the best equipped to answer, questions related to COVID-19 in your care. So please do not hesitate to reach out to your care team. One of the questions that I was tracking that seemed to get a lot of attention, and Dr. Green and Dr. Keenan, I'll go to for this. Do you recommend that our patients get a flu shot this year? And then related to that, how about the pneumonia vaccination?
Yes, so this is John Green, and I would recommend that you get the flu vaccine. I would wait until the beginning of October so your immune system will be primed for the entire season. If you get it too early, it loses its ability to protect you later in the season. So anytime in early October is a great idea. The COVID-19 vaccine is not readily available, although people have signed up to be an experimental participant to see if they can get it. Once it is coming out, it's going to be used for frontline people, first of all, which are healthcare workers, and then they want to make sure that it's distributed evenly to minorities as well as other groups that also are at high risk. As far as Moffitt having it available for patients, that is not happening anytime soon until we know that the availability is starting to be released to hospitals, which I have not heard any word of that, but once it is available, we'll be happy to administer it. And then who should get it? Check with your doctors, but if you are highly immune suppressed and you've had immunotherapy, chemo, or transplant, you may not be able to mount an immune response for up to 3 months after that treatment, and you may have to wait until that immune system recovers after your treatment. And your doctor will tell you exactly when your immune system is ready for a vaccine. And hopefully, It sounds like it will not be a live vaccine, so it will be safe for immunosuppressed people like the flu vaccine. And please get the pneumonia vaccine as well on time if you need it.
Great. Thank you, Dr. Green. We are just about at 1 o'clock. I did want to let everybody know who is on this webinar. We will be doing a recap of the session. We'll roll up kind of main themes, the recurring questions that we saw, and we'll make sure that goes out to everybody that joined us today, as well as the replay of this recorded session. With that, I do want to hand it over to Jack, Patty, and Shani to maybe say a few closing words or address any outstanding last thoughts.
Well, this is Jack, and I just want to thank everybody for all of their time and their thoughtful questions, and we'll do our best to get answers back to everybody, whether it be to the person directly or through the Q&A and subsequent follow-ups that we'll have. But thank you all. Keep wearing your masks and social distance and do all of the right things, because you all as cancer patients and family members and supporters of cancer patients are doing all the right things. Keep it up. Thank you.
Hi, this is Patty. So I want to say 3 things to you. I want to say, when you feel worried or concerned about going out and traveling around, everybody said it so beautifully through this presentation. Cancer patients know how to be safe. We are conscious always about our surroundings when we're out. We're conscious always of crowds. So trust in your instincts. And if you feel anxious, why don't you look at that list of virtual support programs that Moffitt is put out to support all of us. You will find what you will be pleasantly surprised to find, that you're not alone. Thank you all for joining today.
Thank you, Jack. Thank you, Patty. I'm sure you'll agree that today's presenters have provided us with a wealth of information to assist us when we're planning our visits to the hospital for appointments. And we can now be confident that Moffitt Cancer Centre will take great care of us all and keep us safe. If you're interested in future patient and family webinars, please do send us your suggestions of topics for future forums. I'd like to thank you all again for joining us today and wish you all an excellent rest of your day. Be safe and be well. Thank you.